In today's video, we are going to learn image-based multiple choice question related to normal newborn. So question is true about Cephalhematoma is or are. We can select multiple answers from the question. The options are limited by sutures, it is due to fluid collection, it regresses in 24 hours, or it is due to birth trauma. So let's look at the Cephalhematoma. Cephalhematoma is a collection of blood between periosteum of the skull and bone itself. The swelling with cephalhematoma is not present at birth, rather it develops within first 24 to 48 hours because it takes some time for the collection of the blood. It resolves after 3 to 6 weeks. It might take months also, and it can complicate in exaggerated physiological jaundice, or it can get infected also. This occurs due to rupture of periosteal capillary due to pressure of birth, and it is commonly seen in instrumental extraction including vacuum and forceps. So in our question, the options are limited by suture, correct. Due to fluid collection, no. Due to blood collection, so this is wrong. Regress in 24 hours, that is also wrong. It start appearing around 24 hours and it is due to birth traumas. So correct answer to this question is limited by suture and it is due to birth trauma. Identify the correct statement regarding caput succedaneum. Occurs between skull and periosteum. Increases size for 12 to 24 hours then stable. Does not cross suture line. Resolve within 48 to 72 hours. So let's learn about caput succedaneum. Caput succedaneum is the edema of skull at the neonates presenting part of the head. It appears over the vertex of the newborn head as a result of pressure against the mother's cervix during labor. The edema in caput succedaneum crosses the suture line and it may involve wide area of head, or it may be just be a size of large egg. It occurs due to compression of the tissues in the girdle of contact, which results interference of venous return and from unsupported area of the scalp that causes stagnation of fluid and lymphatic drainage. We can remember this with the mnemonic CS. It's a cap-like swelling. It crosses the suture line and it is commonly seen. So in our question, it occurs between the skull and peri. No. It increases in the size for 12 to 24 hours. Does not cross the suture line. It crosses the suture line and it resolves within 48 to 72 hours. Correct answer to this question is option D, resolve within 48 to 72 hours. Let's look at the sum of the difference between caput and cephalhematoma. Caput is present at birth. Cephalhematoma appears after birth and increases in size for 2 to 3 days. It is a soft swelling. Cephalhematoma is well-defined swelling. Caput crosses suture lines. Cephalhematoma does not cross suture lines. Caput disappear within 2 to 3 days. Cephalhematoma disappear in several weeks, it might take months. Caput is commonly seen and complications are rare. Here common complications could be jaundice as well as infection of. The next question is mastitis neonatorum is in a newborn is seen due to mother's estrogen, mother's progesterone, GnRH or gonadotropins. Mastitis neonatorum is bilateral fullness of both breasts. Overlying shows no signs of redness, warmth or tenderness, and it is due to high level of maternal hormone, the estrogen. Massage or squeezing of the breast is not recommended. So correct answer to this question is mainly it is because of maternal estrogen. Next question is, when does erythema toxicum neonatorum usually appear in newborns? Within first 2 weeks, within the first day, within the first 3 days of life, none of the above. Let's learn about erythema toxicum neonatorum. Common benign skin condition seen in healthy newborns. Affects 30 to 70% of newborn. It is more commonly seen in term babies. The lesions are characterized by multiple erythematous macules and papules ranging from 1 to 4 mm that rapidly progress to pustules on an erythematous base. They are usually found over the trunk and proximal extremities, sparing the palms and soles. They may be present at birth but typically appear within first 3 days. Infant with erythema toxicum neonatorum otherwise are healthy and lack systemic symptoms. Eruption is self-limited, with most the rash resolving within 2 to 3 weeks. The etiology of ETN is unknown, however has been postulated to involve the immaturity of pilosebaceous follicle, which include the sebaceous gland and the hair follicles. It is due to suspected allergic or immunologic etiology. This condition is usually diagnosed clinically based on good history and physical exam. A periphery smear of the content in the lesion can be done, however it is not essential. Upon microscopic evaluation of a weight stain smear, there are copious amount of eosinophils seen exceeding 90% with a limited amount of neutrophils. No treatment is necessary for ETN. Simple reassurance is given to the parents regarding the benign temporary nature of this skin condition. So correct answer to question is option C, within the first 3 days of life. The next question is, what is the characteristics of milia? Is it a small papule vesicle with erythematous flare, a raw blistered area on fingers, hand and distal forearm, 1 to 3 mm vesicle and erythematous papule, more than pustules, more than crust, more than erosions? Or is it benign whitish tiny sebaceous retention cyst? So let us explore all the option one by one. Small papule, pustules and erythematous flare, then it is erythema toxicum neonatorum. The second option is raw blistered area on fingers or hand or distal forearm. These are called sucking blisters. These are not milia. The differential diagnosis could be bullous disorder, but in bullous disorder, these are multiple. Sucking blisters are evidence of in utero sucking behavior. The third option was pustules, papules and vesicles. That is typical of neonatal varicella. Neonatal varicella occur when a mother contracts chickenpox within 5 days before or 2 days after giving birth. Here, the widespread vesicular rash with lesion beginning as macule and rapidly becoming papule, simultaneous occurrence of various rash stages are seen in varicella. It appears in croak, typically begin on scalp or face. On the other hand, milia is seen in newborn infant as a tiny white elevated spots in the skin. On occasion, there may be a narrow red halo around the base. This is normal and self-limited condition in the newborn. This is small retention cyst. It occurs when the dead cell becomes trapped in a small pocket at the surface of skin or mouth. It doesn't require any treatment. Parents should be reassured about the benign and self-limited nature of the condition. So option A is erythema toxicum neonatorum. Raw blistered area only on hand. It is a sucking blister. The third one is neonatal varicella. And the fourth one is benign whitish tiny sebaceous retention cyst is characteristic of milia. So option D is the correct answer. The next question is, what is this image showing in baby who is 2 days old? Options are milia, erythema toxicum, harlequin color change, or is it port wine stain? At the end of the video, now you all know that it is neither milia nor erythema toxicum. So let's look at harlequin color change and port wine stain. Harlequin color change appears transiently in approximately 10% of healthy newborn. It is distinctive phenomenon, presents as a well-demarcated color change with one half of the body displaying erythema and the other half paler. Usually it occurs between 2 to 5 days, but it could be seen as late as 3 weeks of life. The condition is benign and this change of the color fade away in 30 seconds to 20 minutes. This benign condition should not be confused with harlequin fetus, a severe and uncommon form of ichthyosis manifesting with large plate-like scales and fissures over the body. Now, port wine stain. It is also known as nevus flammeus. It is a vascular malformation, a type of hemangioma. It manifests as a prominent flat pink, red or purple mark that does not blanch. It could be a possible manifestation of Sturge-Weber syndrome, so it requires further evaluation. So in our question, we all know that it is not milia or erythema toxicum. This is not even a port wine stain. This is harlequin color change. So option C is the correct answer. Thank you very much for watching this video. Please give like, subscribe and share to your medical friends. Please let me know what other topics you would like to learn from me.